Hello everyone, this is James Braithwaite with Braithwaite Physiotherapy. Where am I right now? I'm at home. And we're at home today because we're going to teach you a trick for managing swelling after an injury that we should all be able to do at home. This is not about having a professional manage things for you. It's about you being able to manage your own stuff on your own wherever you are. We're going to use today to manage swelling after an injury something that a lot of people have kicking around in their garage, an inner tube, right? So this is a bicycle inner tube, garden variety. I picked it up at Canadian Tire. You can get it at your local bike shop. You can get it anywhere that sells inner tubes. I'm just going to take a pair of scissors and I'm going to cut my inner tube. I'm going to cut it transverse right across the middle. I'm going to take the valve out like so. And then I'm going to cut longitudinally right down the tube, just like that. It's going to take me all of about 30 seconds to do. You can impress all your friends as you do this. You can explain what you're doing. You're the MacGyver of home injury management. As you do this, everyone's very impressed. You can do this on the bike trail. You can do it on a soccer pitch. Great little trick. The reason that we're doing this, by the way, what are we going to do with our inner tube? We're going to use compression to manage the swelling. So, you know the old adage of rice after an injury: rest, ice, elevate, and compress? Well, the inner tube is going to allow us to do the compression component of that rice protocol. And I actually like the compression a lot more than I like the ice part of rice. There's a growing body of research to suggest that ice is not necessarily helpful in the acute phase following an injury. In fact, it can suppress the local immune response that our body uses to help heal. So I'm actually recommending to my clients now that immediately post-injury, 2 to 5 days post-injury, focus on the compression, the elevation, and the rest part, but not necessarily the ice part. And this is a trick that you can use for the compression. I'm going to make a little roll out of it. That makes life a little bit easier, right? It's a little bit dusty after you first cut it, but that dust can be washed away. Or if you don't care, if you're not fancy like me, you can just not care about the dust. It'll go away quickly. Okay, so here I am making my roll as if this was a tensor bandage, right? Just like so. And you end up in all of the space of about 1 minute with this handy roll. We're going to use the band to compress, and we're going to do it thusly. Let's pretend that I've injured my knee. Let's say I was playing soccer and I took a cut and my knee fell into a valgus position and I've irritated maybe an MCL or an ACL and the joint's starting to swell because of it. So I'm going to go into I'm going to get myself down to the ground. I'm going to elevate, right, the E part of my rice protocol, and I'm going to use my band to compress. Now here's how it's going to work. Come on in here, let's take a look. I've got my roll. I'm going to start below the joint, right? I'm going to wrap with 75% compression below the joint. So 75%, what does that mean? That means if the most that I can possibly stretch my inner tube is 100%, I'm going to go for 3/4 of that strength, okay? I'm overlapping about 50% of the width of the band for each pass around my leg. Nice and snug, nice and snug. That feels good. You're impressing all of your friends on the sideline of the soccer pitch when you do this. As I start to get above the joint, I start to loosen a little bit. So above the joint, I'm going down to about 50% compression, right? Just like so. I'm gonna, at the top, I'm gonna leave a little bit of space so that I can tuck the band in, just like so, right? And now I've got this nice, snug band that's rubberized around my swollen joint. It's about 75% compression down below and loosening to about 50% compression up above. Now that I've got all this stuff in place, I'm gonna start to pump my ankle, just like so, right? And what that does is it contracts the calf musculature, and that's going to start to push all the fluid that's accumulated in the injured joint into the lymphatic vessels. And the lymphatic vessels are the vessels that take excess fluid out of your tissues and return it to the regular circulatory system. So this is a great protocol that you can do on your own, at home for home compression. So I'll lie down, I can watch TV, I can read my book, I can just hang out and chat. I'm just going to pump that ankle. Get that musculature pushing the fluid into the lymphatics. I'm going to do this for anywhere between 2 and at the upper end 10 minutes or until the onset of numbness. If you start to feel numb, that's not a bad thing, but it's an indication that you're done. Once you've achieved that level or at the that numbness level or at the upper end, about 10 minutes of ankle pumping, you're going to unwrap just like that. You're going to notice that the skin is blanched. That's okay, it's nothing to worry about. You push a lot of fluid out of there. You probably drained some blood out of the region too. It's okay if the skin looks parched or blanched. But you should notice an improvement in the level of swelling afterwards. If you're doing this type of a protocol for swelling management, then you can do that up to 5 times a day. You can also use an inner tube band like this for tissue release as well, which is a trick I'm going to show you in a separate video. If you're doing for tissue release, the protocol is slightly different, but in this case, you do it as shown up to 5 times a day. It's a great way to manage swelling, and it's a simple and easy trick to do at home. So try that one out. If you have any questions, obviously give me a call, make a comment on the video below. I got this trick incidentally from a physio guru that I follow, Kelly Starrett. You can check out his website, mobilitywod.com. I'll put a link to that in the video comments, in the description down below. He has specialized bands you can use for doing this as well. I'll put a link for that as well. But as I say, you can just use a simple inner tube to get this trick done. It's a great thing for you to do at home, and it's also a conversation starter for you and all your friends and family. So give it a shot. Let me know how it goes. James Braithwaite for Braithwaite Physiotherapy.